Why can always respecting your patient's wishes become the worst thing you can do for them? Yep, you're very right. We basically have patient autonomy hammered into us from day one in nursing school, right? But have you ever stood there at the bedside with a patient who's clearly not capable of looking after themselves and thought, should I really just let them do this to themselves in the sacred name of autonomy? What do you ever do in that situation? The obvious correct answer is the patient decides. End of story. Done. We listen, we respect, we facilitate their choice. That's the core of good nursing. But here's the twist. What if the patient is so affected by their illness, by medication, delirium, dementia, you name it, they're simply incapable of exercising that fancy autonomy? What if their choice is actually a symptom? Suddenly, respecting the patient isn't a simple solution, but a potential ethical minefield. And this is where the Norwegian nursing philosopher Kari Martinsen enters the picture, with a concept that at first glance sounds a bit, lame. Weak paternalism. Doesn't it sound a bit like a spineless boss? I'll sort of be in charge, but not really. But hold on, it is way more brilliant and necessary than it sounds. What you think you know about patient involvement, that's only like 10% of the story. Okay, so what is weak paternalism? It's not that I know best attitude where we steamroll over a competent patient's wishes because we think they are wrong. That's called strong paternalism, and it's generally a big no-no. Weak paternalism is those situations where the patient's capacity to make rational autonomous choices is temporarily or permanently diminished. Think of it like taking the car keys away from your friend who has had way too much to drink at a party. Your friend might be yelling that they're totally fine and they should have home, but you know they're a danger to themselves and others. You intervene not to control their life forever, but to prevent a disaster right now. You are exercising weak paternalism. You act on their behalf for their benefit in a situation where they can't do it themselves. I've been there countless times myself. The patient with severe dementia refusing life-saving medication because they don't understand why. The patient in post-op delirium wanting to rip out their IV and get out of the bed even though they just had hip surgery. The deeply depressed patient refusing all help and care. In those situations, just saying, okay, we'll leave it then. It's not necessarily respecting real autonomy. It can actually border on neglect. Martinsens argue that in those specific situations, it is our duty to act caringly on behalf of the patient based on what we know about them or what is generally considered to be in the person's best interest. But, and this is crucial, it has to be as minimally intrusive as possible, and only for as long as absolutely necessary. That is why it's weak. It's an emergency measure, not standard procedure. And if we take a patient that's a little more capable, then weak paternalism is using your knowledge to guide them in the right direction. But let's get back to our initial paradox. Why can blindly respecting a patient's wishes be the worst thing? Because sometimes the wish isn't a free, informed choice at all. Sometimes it's the illness talking, and that is where weak paternalism isn't just an option, but an ethical necessity. It's the lifeline we throw out when the patient's own judgment is temporarily drowned. But where exactly is the line drawn? When is a patient incapacitated enough, and how do we ensure we don't slide into that strong, unacceptable paternalism just because we think we know best? That's the real $1 million question, and I'd like to hear some of your input. So write it down in the comments. I love to read them all, and I will take them up in another episode where we talk much more about the border of this weak paternalism. When should we act and how should we act? So write down your episodes down in the comments, and also how you solve them. I will be happy to hear that. And if you want something informative to see, then check out this video, which has much more on nursing and health, and is picked especially for you. So make sure you check it out right now.